Good morning, everyone. Lisa Hurley from York County Development Corporation today. Thank you for joining us on our, whether it's a Zoom call or on the Facebook Live. Hopefully we have fixed the Facebook Live streaming issues from last week. If not, we will get the video released out on York County YCDC's Facebook page later, as well as the internet. So for now, I would like to introduce Laura McDougall so she can do our Four Corners update.
Good morning, York County, on this last day of April. I am glad to be here and be able to give you a report this morning. I want to start off just giving a little bit of information about the Four Corners situation. District situation, we're up to 28 positive cases now in our district. We've run over 500 tests now in the district with 28 positive. So right now, York has held steady for a few days at 11 cases. Seward County has 7 with 1 death. Polk County is up to 7 cases and Butler is at 3. We have 16 people who are recovered at this time. And in quarantine currently, we have 62 people in quarantine, and those are all as results of the contact investigations, contact tracing that we've been doing with the known cases that we have. Now, over time, since this whole thing began, there's been 412 people that have been monitored and in quarantine. So over time, we've had 154 people in York County that we've monitored in quarantine, but with a district total of 412. So looking at the broader state of Nebraska, we have, we're up to almost 3,800 cases today with 68 deaths. Looking around us, and what we tend to do at Four Corners is we really like to look around us. It seems that we're really noticing a pattern now that the cases that we're getting in our district are due to people working outside of the county at different places and living in our county, or they've traveled outside of the county and brought it back with them. So we kind of look around us and see what's happening around us, and I think especially to our west, we're seeing Hall County with 943 cases just in Hall County. So that is something that we've been carefully watching. Lancaster County has 204, Platte County is up to 66 now, and Saline County is at 107. So we're really looking around us to see, watching those numbers go up around us and trying to be very vigilant as to what's going on in our county. We have had a little bit of rise in numbers, but it has been, we're really doing pretty well at 28 cases for our 4 counties. Okay, so going on then, the big news I think that's coming up that everyone needs to know about are the new directed health measures that will start on May 4th. So be watching for those. I do not yet have a copy of what the document is going to look like, or the official document. So please stay tuned. As soon as that the new directed health measures come out, we will post them on our website. We will also be sending them a link to those new directed health measures out to everyone that's on this email list for this briefing. In terms of the new directed health measures on May 4th,
Everybody's frozen for some reason. Oh. I'll pause. Can you put a chat out if people are
wondering if you could type in the chat box, please, if we're frozen on our end with if you're still receiving video.
Okay, still getting video. Okay.
Okay, good.
Okay.
Great. We were worried we were talking here for just to ourselves.
Okay.
All right. So as of May 4th, we will have these new directed health measures. The And what you're going to see in these directed health measures are that they're going to be starting to allow the elective procedures happening at the hospital. And hopefully our medical sector can talk a little bit about that. Dental procedures will begin to happen again. Restaurants will be able to open up to what they have been licensed for, 50% of their licensed capacity ratings. And we have a lot more guidance that if you have questions, you can definitely call. We'll be posting some more information about this on our website as well. And it will all be outlined in the directed health measures. But our restaurants will be able to have dine-in now. Salons and barbershops will be open again, tattoo parlors. Everyone has to be masked in those situations. Our churches will be allowed to have services again. And again, there's some restrictions though, that are some specific directives along with how church can be held though. So stay tuned, for those directed health measures to come out to give you a better idea what that looks like. In terms of other gatherings and things though, there's still going to be with the 10-person limit. So just to that's a very brief overview of a fairly complicated document. So when it comes out, we'll make sure that that's in your hands. I want to give you an update on personal protective equipment that's being distributed in the district. Today, we're really expecting, we haven't received news yet on what we're getting for this week. And I realize it's Thursday. We haven't got our pick list yet for what is coming. We're still trying to fill the orders of our top tier priority list, though. We have not received enough yet to fill those orders. So we're still working on getting the orders filled for the top tier priority list. As for a Four Corners update, just for us internally, we have been putting together contact tracing teams with some of our local partners. So we thank all of our local partners that have helped us out with some individuals to augment our staff. So thank you very much for your partnership. And I just like to give a shout out to the schools and school nurses and the York Medical Clinic for helping us with contact tracers and interpreters. So thank you. And with that, I think that's my report. Thank you.
Thank you very much, Laura. Okay, next up is the local government sector. Is Randy on for the county?
Yep, good morning. We don't have a whole lot of difference going on right now. I just wanted to touch on a couple things about what we have coming. The DMV, which is actually a state office, operates obviously out of the courthouse. They are looking at a possible starting to see people in the courthouse next Thursday and Friday. I believe it's the 7th and 8th. So you'll have to look forward to what type of announcement or look online to deal with that. They'll run a little bit differently. You're going to have to call in, just come in for your appointment. You won't be able to do kind of walk in like you used to. So that'll be a little bit differently, but it'll be a start. And we're hoping May brings a new start for us. As far as the offices on the main floor, they probably will not open up till after the elections, which is the 12th. But we don't want to give the false impression that people can come into the courthouse and vote, which you will not be able to other than the polling place, which is in the basement. So that's really all we got going. Just proceeding forward. Everybody's using the drop box that was installed, and that's a great thing. And just keep everybody's spirits up. That's all I got, Lisa.
Thank you, Randy. City of York, Barry, are you on?
I am. But really, not a lot of changes with us too. We're going to kind of stay the course here, keep the city buildings closed, look at that from a week-to-week basis. Still separating staff. We're just gonna kind of, be patient with this. Have some decisions. We're gonna usually one hot topic right now are swimming pools, and Laura's addressed that in her other meetings, don't really know what to do. Usually we would fill that May 11th. We won't be doing that. We'll delay a few more weeks, and hopefully the council can discuss that at the second meeting, the 21st of May. And by then maybe we'll have kind of a clear picture. It's such a short season with the swimming pool that, if the earlier conversations that you couldn't open it until July 15th, it probably doesn't make any sense to open the pool. Luckily, if that could start to happen, we would have the community center for at least a backup. But if we couldn't, if things change and it's something that we can get open in June, we'd love to consider that for the kids. We know it's been rough for everybody the last month or two, and love to have them have something to do for the summer. But that'll be a topic we'll continue to watch. We have been able to get the landfill back open with some partial hours, at least to allow the public to go out there. So appreciate the efforts of everybody doing that. And other than that, the city staff continues to stay busy working on projects and getting ready for when this comes back to normal, and we'll be ready for people to use our facilities again. But in the meantime, the parks and the trails and things other than playground equipment are still there. And I think I've seen more people walking dogs and going for walks and riding bikes in the last month than I've ever seen. So with everything, at least there's some good family time and people are getting out and enjoying what we have to offer. So that's all I have today.
Thank you very much, Barry. Is anyone on from City of Henderson? No. All right, they just texted, no update from Henderson. What about Village of McCool, Village of Bradshaw, Benedict, Waco, Gresham, anyone else from the county communities? Okay, well, I will say I have heard from a couple of them that if they don't say anything, they have nothing to report. They're just participating to hear what's going on throughout the county. So thank you for that. We'll move on to medical sector. Is Jim or Cheryl on? Jim, are you available?
Yes, I am. Good morning, everybody. Yes, I will touch on the gradual reopening of some services that we're going to do. And there is a press release that hasn't gone out already. I know it'll go out. It should go out today. If not, it is complete, and it'll detail out a lot of the specifics about bringing on our process for outpatient surgeries and outpatient procedures. Because it's, and you can imagine it's going to be a fluid plan as well, because we need to monitor, as Laura's talked about, the COVID-19 situation in our, in our community, in our region, throughout the state, and so on. Plus, we have to adhere to the, the guidelines of having 2 weeks of personal protective equipment maintained at all times. Vacancies in our hospital, to have 30% vacancies in our hospital beds, as well as the ventilators as well. And we've got 3 ventilators, so if we use a ventilator, then we're not going to be holding surgery. So we also keep an eye on the bed capacity throughout the state, because that will enable us, if we need to, we have a COVID-19 patient that is here and needs a ventilator, we probably will end up transferring them on, depending on the capacity that would be in the surrounding larger hospitals, like in Lincoln at Bryan, for instance. Watch for the press release. As I mentioned, it's got a whole lot of specifics. I'll just give you an example, because it's going to point out how visitor restrictions will stay the same, is what they are. That patients are going to be required to wear a cloth mask, that can be brought from home, and all patients will be screened at least 24 hours in advance. York General is going to continue what we do in the way of daily temperatures and symptom screening for all hospital team members. So we're going to keep all those things up. Practice social distancing. We're going to be monitoring this on a weekly basis and daily basis if needed, but we're going to be scheduling out 2 weeks in advance. So we're not even going to allow the schedule to be loaded up more than 2 weeks in case we have to change course. But it is going to be fluid. It is going to be something we have to continually analyze because, you know, top priority is and always will be the safety of our patients and our staff. And that's going to be true throughout here. And but there's a lot of individuals in need, a lot of cases that we have that were canceled that we're going to start bringing back on, and a lot of the diagnostic testing that really should be getting done, because we certainly don't want cases that are elective today to turn into emergent cases if we can handle them safely today. And so it's certainly, we have what is in place, needed to be in place to carry this out in a safe fashion. And so we're going to continue being fast in our efforts. That doesn't, certainly the Hearthstone and Willowbrook are still closed down as they have been, and they will continue that way, and probably not going to do elective surgeries or procedures on residents at either one of those units. And of course, we will attend to them as we have if they become emergent needs. So that's a little bit on that end. Also, we're going to be doing a Facebook video early next week to do a little more on the opening of elective procedures and just a chance for us to say thanks to all of our community partners too throughout all of this. Did want to, I mentioned in our call as well, the Four Corners District call as well. I mentioned to Laura that certainly want to reach out York General and to do what we can to be partners with Four Corners and helping to educate or provide assistance in any way to some of those businesses that maybe, have a large contingent of employees together, kind of like the processing plants. I know we don't have any of those here in York, but that maybe could carry some of the same risk and maybe has some language barriers with some of their workforce. And however we can work with Four Corners to help address that. And to that end, I just want to have a shout out to York Public School System and Mitch Bartholomew and Principal Loosefelt as well, that just in their willingness to work with us and to provide some talking points. And their resource that they do at the school already is to reach out to those Spanish-speaking families and give them some updates. And so if we can provide some talking points, I think they can certainly do that, and be happy to work with Four Corners in any way we can to help with that service and to help with that education and communication that's needed. That I think Laura would agree that has been something that even the governor has talked about needing to get on top of a little bit better in the state of Nebraska from the start if this were to happen again. So I think I will leave my updates at that for now. And if there's any questions, let me know. Thanks so much.
Thank you very much, Jim. Anyone else from the medical sector that would like to provide a report? If not, I will just pass on. I have talked to several of our eye care clinics, dentists, the like. And from what I've been told, many of them are going to be following the same procedures, making sure you have a face mask on before you get in. Some of them are going to be asking you to text on the way on in. Okay, now on to myself, business sector. I want to thank all the businesses in the community for being dedicated and continuing to be creative in how they address the COVID. We've had several conversations from the childcare providers all the way to the manufacturers coalition. And there's been a lot of good information coming out with that. I will say, as you know, jobs are looking different, and they're probably going to continue to shift a little bit over the next month as we start to open up. But also, we may see some long-term changes from how some of the jobs in different sectors look. I know the York News Times will be releasing a report out on the up-to-date unemployment numbers that came out this morning. I haven't been on their website yet. I don't know if it's out yet, but keep an eye out for that. We do have some employees that are furloughed that are working some reduced hours. I heard from a manufacturer yesterday that those hours are starting to increase again because out on the East Coast, their customers are ordering and they want their stuff now. So that is great news. We're always a little bit behind the coast, but it does affect the people that are right here. Our buy local program, I just want to remind everybody that's what YCDC, Cornerstone Bank, and the York Area Chamber sponsored. So businesses can upload your information for customers to buy gift cards at no cost. It's hosted by the York News Times. Thank you, Carrie, for taking that on. Really appreciate that. And if you need a gift card for one of our local businesses, please go on there. I know the chamber has had a challenge, and Madonna will talk about that again. She talked about it last week. And as a reminder, for those of you that have not submitted yet, but are working on the City of York's Community Development Block Grant COVID Response Fund, those applications are due. You may call me either at the office or on my cell phone. You can stop in the office. Madonna or myself can help you with that. And I really just want to thank everybody for doing everything they can. Our financial sector being so on top of the ball with helping our businesses. It shows that we have a strong community. And then I'm going to turn it over to Madonna.
Good morning, everyone. Thank you, Lisa. I want to continue to echo a lot of what Laura and Jim and Lisa have said about the reopening process. So first, to kind of go off of what Jim said, I've been reaching out to York General's marketing team, and we will be partnering together to help York General pay it forward. They appreciate so much all that everyone did to help them secure PPE with the homemade masks and everything. Now with the reopening and the mandates that have been given to the eye care professionals as well as the dental and the hair care places, York General wants to help them be able to provide masks for their clientele if for some reason a customer forgot one, so they can continue to offer those services. So be watching for that. Leslie Robinson and I will be putting together something for that. Also, Laura touched on churches. I know a lot of houses of worship are looking forward to be able to gather together, but they do want that to be in a safe manner. Our team here did put together a very simple survey that we have put out through the Ministerial Alliance as well as through our membership, just to maybe help those church leadership teams gauge their plan, be it early May, late May, or even June. So if you're interested in having that survey, we have a generic one, just so you can kind of test drive it and see if that's something that will fit for you. And if so, you can just let me know and I will tailor the time question, of course, head the survey for your specific church. And we just want to be able to help you with the tools as you make those plans and move ahead. I really just want to stress, as we do reopen, just to exercise a lot of patience and kindness. A lot of businesses are choosing to wait a bit. Some are going to choose to open when they're allowed. And just bear with everyone when you do have that opportunity to go into your favorite restaurant and sit down and have a meal. Those team members are having to adjust a lot of their processes to be able to attend to you. So I echo what Lisa said. Our community has been fabulous in supporting one another emotionally, financially, and I just really look forward to that continuing as we move through and look forward to the days of summer.
Thank you, Madonna. Okay, anyone else on the line that want to talk on the business sector about your particular business? Okay, we will move on to education sector. I do have a message from YPS. They were not able to be on this morning. Their school board, the YPS school board, voted to end school a few days early on May 15th instead of extending into the rest of the week. And that's the only report Mitch has. Brad, are you available, or Kurt from Cool? Anyone from Nebraska Lutheran? Okay, then let's move on to faith-based and nonprofits. Any of our churches on the call today that want to speak up? What about our nonprofit sector? Erin, are you on? Or Brandy, do you have anything to report?
I am on. This is Erin. Good morning, everyone. I'm Erin with York County Health Coalition. We did get information from East Hill Church of Christ that they are going to do their free clothing giveaway. They are doing it slightly differently this year. Instead of doing it all on one day, individuals are able to make an appointment with the church to come in for 30 minutes to shop. There is some information starting to go out. A couple things that weren't on that flyer when you see it is they will continue to take appointments until either they run out of clothes or they just don't have the manpower to do it anymore, or directive health measures change and they need their classrooms back for worship services. So at this point, they are also continuing to update their clothing. So people do not have to worry about all the good stuff being gone at the beginning. You just make an appointment when you're able, and they're going to do their best to have good selections for everyone, no matter what time you make an appointment. East Hill is also going to host the mobile food pantry again tomorrow, which is the first Friday of the month. It will run very similarly to last month's, where it will be a drive-through, drive-in. Someone will bring a box out to your car. You will get out and put the box or bag into your car. They will also have the National Guard there this week to help with that. We also found out that Living Water Mission does have some supplies like shampoo and toothpaste and soap. Please call ahead if that's something that you need so they can get those items together for you. They are also still doing meals. They are to go. Again, please call ahead if you need a meal and they'll box it up for you and you can pick it up. Our COVID-19 relief fund is still taking applications. We are still more than happy to help and to refer individuals to other services that are in our area. We have heard several people who are very kind, but a reoccurring theme is that people do not want to apply for SNAP or unemployment because they want to save it for others, which is a very kind, very big-hearted thing to do. But we do want to remind everyone that those funds are there to help us. We are all in this storm. There is no judgment passed, no matter what your profession is, no matter what your background is or your family connections. Those funds are for everyone to be helped. So we really encourage you to apply for SNAP, to apply for unemployment, to apply for energy assistance, to apply for any funds that have been set aside for individuals during times of crisis. Those funds are there to help. So please take advantage of them. And don't wait to apply. If you have applied in the past and you have been denied for SNAP, particularly maybe because your income was too high, if your hours have been changed, that counts as a significant change in income. So please reapply because you may be eligible now for things you weren't eligible for 2 or 3 or 5 weeks ago. Those lines are getting long, so we do encourage you to apply now instead of waiting 2 weeks because you'll be 2 weeks even further behind. So please do try to access those funds. In partnership with Nebraska Children and Families Foundation, we did hear that they are working on a Spanish hotline for individuals to get help and to get connected with us. We currently here at the coalition do not have a bilingual ability, but through Nebraska Children, we are working on that. So more information will come in the future. And then lastly, just want to remind everyone that May is Mental Health and Trauma Awareness Month. Yesterday, we kicked off Mental Health Month by hosting a mental health and COVID-19 webinar or interview with 3 local mental health professionals. I want to thank them and all of those who attended. 2 of the things that I'd like to share from that that I thought were really insightful is one, that we're all in this storm together, but we're not all in the same boat, and that's okay. So to acknowledge that we all are going through different things right now, and to have grace for each other. And the second thing is that we have lost a lot unexpectedly, whether it's a job or how we communicate and interact with each other, or even just those of us who are still coming to work, how we function in the workday. And it's important to acknowledge the grief and to name it. And it's okay to name that we may be grieving right now, and to not just push it aside. So please be mindful during this next month and actually through all of this season, and extend grace to each other and to yourself. That's all I have for this week.
Thank you very much, Erin. That was well said. Before we go on to the nonprofit, I have to apologize. I forgot to ask York College and Southeast Community College if they have anything to report.
This is Emily from York. I do want to point out that we have announced that Soul Quest will be canceled this summer. It was going to be the 40th consecutive year that that event happened on campus. They're moving to an online format. So not entirely sure what that looks like, but more information will be released on our website for that. And also it was announced last weekend that we have rescheduled graduation for homecoming this year. So we will celebrate all those 2020 grads October 17th on campus.
Fabulous.
Nothing really has changed with SEC. We are still continuing to work on putting more of our classes on Zoom platform. So that will be coming out. We have some information that will be put out through, if you receive our constant contact list. I will also be putting things on our Facebook page. And I think we're going to be working to also update all of that information on our specific Learning Center web pages. So that'll all be coming out as we get closer to those classes. Otherwise, it'll still be just looking at when we're going to be back into our locations, and then how things will look as far as the credit classes after that June 1st date, if we're going to continue keeping those all online, or if we'll be looking at any of those being put back into the face-to-face. So we're really kind of in the same boat we've been in, and just working to continue trying to offer everything that we can to our communities.
Thank you very much, both Emily and Heather. Okay, back on to the nonprofits. Brandy, do you have anything?
Hi, good morning. This is Brandy from Health and Human Services. I don't really have anything new to report. Outside of, we are seeing continued abuse and neglect reports in our county. That is happening here. Families are more stressed than normal. The families we're working with are isolating themselves a little bit. So just reminding those of you that are working with families to ask those questions of them, help refer them to resources in the community. And if you need help finding resources, you can always contact our office, contact myself, contact Erin Sams, or Bev, the community response coordinator. But just wanted to talk about that because families are struggling right now. And if you even just think of yourself in this situation, it's a harder situation, much harder for families who can't access mental health services the same way they normally are, and those kind of things. So if you need help helping a family navigate things, feel free to reach out, because I'm happy to help work through that or help find solutions. That's all I got.
Thank you very much, Brandy.
Yep.
Anyone else from the nonprofit sector? Okay, so let's move on to questions. Laura, do you want to come up for questions? Does anyone have any questions to ask Laura, myself? Okay, just type them into chat if you do, and we'll call them on up. Okay, it doesn't appear that we have any. Thank you very much for joining us today. If you need anything, reach out to one of us and we will see you next week. Thank you.